So we can either have a unilateral flexion on one side or a unilateral extension on the other side. Okay? So if it's a flexion, it's going to be deep and posterior. That makes
Inferior.
sense? Inferior, pardon me. Yeah, actually, it's deep and inferior. That's right. Okay, so, and when they come up on their elbows, that side will get better. If it was an extension on this side, then this would get more deep, and the findings would be worse, okay? So that's an extension on the other side. Are we okay with that? Inhalation goes with
Counter nutation.
exhalation goes with nutation. So when you take a breath in, the base
You
comes
counter
back,
nutation.
and when you breathe out, the base goes forward. We're good with that? Okay, so breathe in, breathe out. Okay? That's important
makes
to know,
sense.
because that's how you can fix it when they're sitting too. Okay. So if this base is stuck forward, what respiratory cycle am I going to try to use to correct it? What's going to help bring this base back? Inhalation. Okay? Inhalation will help bring that back. It slid down and forward, so I have to open up this side of the pelvis. So what I'm going to do is abduct the leg just a little bit. Not so much that you jam it, but I want to abduct it. Then, do I want to externally rotate it or internally rotate it to gap this side?
Internally rotate.
Internally rotate it, because that's going to pull the ilium off, and that's going to give me more room to let it come back again. Okay, so that's the second question you ask yourself. So you abduct just slightly and internally rotate. So what position do I put the leg in? Okay. And then the third question you're going to ask yourself, which won't be necessary in this one, is, do I need to have the patient up on their elbows or flat?
Well, you're
Well,
trying
if I
to
put
get
you
it
up
to
on your elbows,
extend.
extension of the lumbar spine will facilitate
Flexion.
flexion, and it's already flexed, so we don't need that, right? So we want them flat. Third question is, where do I want to put my force? I'm going to put my force somewhere along this side with this technique. So I'm palpating and I'm kind of just springing as, oh, you know, right there is where I get the best spring, and that's what we're going to come around and help you find. So now I have my hand on this side of the sacrum, the involved side, which is the right side, and I say, take a breath. And hold it.
This is what
And
I
then they breathe
did
out. Take a breath.
last week.
I do it again, and then they breathe out. Take a breath. And then 3 times, and then look it. It looks fixed. Now let's just get them up on their elbows. Make sure. Oh yeah, both sides are still even. How's that? That's as simple as it gets.